All right, let's talk about writing your critically appraised topic paper for Capstone 1. If you get into the Canvas Capstone course, you'll see there's a module where I have put all of this information. In addition, there are some writing resources in there, and we'll jump into Canvas in a minute, and I'll kind of show you around to see what's in there. So, as I mentioned last week, the CAT paper is in support of one of our program competencies, which is systems-based practice. And this is actually one of the practicing PA competencies as well. And our accreditation standards require us to teach you to search, analyze, evaluate, and apply the medical literature. So this is the next step in doing that. For this particular CAT paper, we're going to focus on something other than clinical medical interventions, which is traditionally what CAT papers are focused on. So for this assignment, I'd like you to come up with a focused question related to a public health issue, a patient safety issue, healthcare economics, healthcare delivery, quality improvement, and then brainstorm a little bit. And if you're not sure if your question fits what we're looking for this course, shoot me an email and we'll work through it and I'll help you figure that out. So what is a critically appraised topic? I know back in PA role development with Dr. Derringer, you guys did some work in Journal Club and critiquing articles and critically appraising the articles as well. And so an actual CAT paper is the next step in that process, in that you will be evaluating the body of literature that exists for a particular question and picking between 3 and 5 for this assignment, high quality articles, analyzing those articles, and then summarizing them. So why do we do this? Well, you know, we all have UpToDate, we have Dynamed, we have things that will do this for us, but it's really a skill that's necessary as a practicing clinician and a lifelong learner. So, you know, the body of healthcare research is massive and healthcare changes so quickly. A CAT paper is a nice way for clinicians who are busy and typically not bench researchers. It's a way for us to quickly get answers to what we're looking for, outside of obviously plugging it into UpToDate or Dynamed. So it critiques the existing research, and then ideally a CAT paper will discuss the application of that research to patient care. Now, for our purposes, obviously, we're taking a little bit different approach to it, working on these public health topics. So there are 5 basic steps for writing a critically appraised topic paper, and basically they can be summarized as ask, search, appraise, apply, and evaluate. And so when we talk about asking, we want to ask a focused and answerable question, and the key here, particularly for this assignment, is going to be an answerable question. And we'll talk about that more in the next couple of slides when we talk about question development. The next step, which is search, is to search for the best available evidence. So this gets back to evidence-based medicine and levels of evidence. And I know that in investigative skills this week and for the next couple of weeks, Dr. Packman and the library support staff will be talking about searching databases and so on and looking at evidence. And you guys are already pros at evaluating these. You did it in Journal Club. So as I mentioned, the next step is appraise, and appraising is looking at the study design and determining whether it's generalizable, right? Do we have internal and external validity, and is it relevant to the question that you're asking? And then finally, we have apply and evaluate. So these steps are 2 that we will not necessarily be approaching in this course. Obviously, we're not going to be applying the results necessarily to clinical practice. However, there may be, you know, it may be the case that your clinical question affects your future practice, so you never know. And then evaluation, that's part of that continuous quality improvement cycle, or the PDSA cycle, if you guys have ever taken any of those sorts of courses where you change something, you change your intervention, and then you evaluate the outcome. In fact, it's something we do in the program all the time. So let's talk about the next steps individually. So we have to ask a question that's answerable. So before you sit down and try to figure out what your question is, here's my suggestion. Think about something you're interested in. That will make this a much less painful assignment for you. Think about something you're interested in and plug it into Google. Plug it in the form of a question, plug in a couple of different ways of asking the question, different search terms and so on, and start to think about what's out there, because in my opinion, the most difficult step is refining your question. We tend to think when we're talking particularly about social determinants of health and public health and healthcare delivery models, we think in big picture ideas, and that's great. But for the CAT topic, we kind of have to refine that. And so Google around, find something that helps you determine what exactly you want to ask in terms of your question. So once you are able to refine that a little bit, that's when we'll start having you do some background work. So we want you to search the literature for background information so that you can determine whether or not your question is answerable. That is there anything out there about it? If you have a great idea and you're really curious about a particular question, there may not be any literature to support it. So that's going to be your first step, is doing a literature search to see if anything actually exists. And again, the literature searching is something that you'll be working on in investigative skills. Once you determine that there is a body of literature related to the topic that you're interested in, then we start modeling our question. And I know you've done PICO format in the past. This is the format that we use for critically appraised topics. Helps us focus our ideas. And PICO format obviously is the problem. In our case, it could be the problem, it could be the population, and then the intervention. So what was done, you know, in classic bench research, obviously this can be drug testing or doing randomized controlled trials with medications and things like that. It will vary a little bit with this type of question that we're doing in this particular course. Again, if you have questions about it, email me and we'll work on it together. Often there will be a comparison. So sometimes this is just a control group, or it's a comparison of one intervention versus another intervention. If you think about healthcare delivery, for example, this may be different delivery of healthcare service lines, right? Different models for improving flow through the emergency department, things like that. And then, and in terms of comparison, there may not be a comparison for the type of CAT paper that we're going to be doing given our topics. Again, if you have questions about it or you need some help brainstorming, I'm happy to help you. And then outcome. So this is the summary of the outcome of the intervention. So how this is going to be different, I've mentioned this a couple of times already, our problem is going to be not so much clinically focused. However, because public health is health, there may be situations where your particular question does have relevance to some clinical intervention. And again, we want to put the public health spin on it. So we need to kind of expand on that perhaps. So, you know, contact me if you have questions and we'll work on it together. Our intervention in this case may be a change in policy, process, structure. Gosh, it could be any number of things. Again, there may or may not be a comparison. And then we really do want to focus, of course, on outcome, right? So how did that particular intervention affect outcomes, whatever those outcomes may be? Okay, so part of the CAT paper, and there's a template in Canvas we'll look at in a moment, is writing up a bit of a background on your particular question. And really the background component of the write-up is the who cares question, right? Why do we care? Why is the problem a problem? Why is it relevant to public health or healthcare economics? Who or what does it affect? This can be populations, this can be, you know, organizations and so on. And how ultimately does that problem affect health and wellness or the lack thereof? You're going to want to provide citations to support your background. So when I talked about doing your initial literature search to see if anything existed about the question that you had, this may be where you run across things that are supporting the background. So we're going to help you answer these questions. Excuse me. So you'll want to make sure you provide citations. We use AMA format, and I know that investigative skills is going to help you work on that as well. So this is something you've seen before, I'm sure. This is the levels of evidence that we use in evidence-based medicine. For this assignment, to find the articles that you'll be using and critically appraising, we want you to search at least 2 databases. So the library staff is going to introduce you, if you haven't already used them in your undergraduate experience or professional life, some of our medical literature databases. And we want at least 2 because we want to make sure that we're maximizing the return on the articles that you're able to find. You'll need to document the search terms that you used and the inclusion-exclusion criteria that you used to determine what would be the most focused and relevant pieces of information. So an example of that would be you decided to exclude any article that was not in English, or you decided to exclude any article that was not based on a certain patient population or any of the other topics that we talked about. And then, of course, inclusion criteria. So we included only cohort studies that had outcomes documented, something along those lines. You want to choose the best quality articles of what's available. And so again, you're going to go through this in investigative skills. I know you've seen it before. And when we talk about quality of evidence, we start with opinion and move up that into the ranks of randomized controlled trials and then systematic reviews. For this assignment, you're going to need to use 3 to 5 articles. They must be peer reviewed and they need to be of the best quality evidence available. So I'm sure you can imagine when we're talking about public health, healthcare economics, things like that, there will likely not be many randomized controlled trials, right? So we're probably going to be looking at case controls, cohorts, and so on. So the answer here really is just choose the best of what's out there. And again, if you have questions, I can help you with that. So what does the CAT actually look like when you write it? So it's only 2 or 3 pages long. I've got a template for you to help you figure out the sections. Your first section is going to be your clinical question, that background paragraph that we talked about, the search strategy that you used. So what were your inclusion, exclusion criteria, et cetera? What were your search terms? A table of evidence, and I'll show you an example of that in a moment. Synthesis of the results, the summary message, and the references. So here are a couple of tips before we jump into Canvas and I show you the template that I'd like you to use for the CAT paper. First off is start brainstorming now. Sometimes this is helpful to do a concept map. It's not necessary, but this is kind of how I come up with ideas. Whatever works for you is fine by me. Make sure it's something that you care about because you have to live with it for the next 12 weeks, right? So make sure it's something that you are interested in or passionate about or have experience with. Look at that timeline for investigative skills content. So look at the investigative skills calendar. I know we talked about at the beginning of the Capstone course last week that it would be in your best interest, in my opinion, and it's of course your decision to make, it would be in your best interest, in my opinion, for you to have your CAT paper due when you develop your Capstone plan and timeline at the end of the semester so you can maximize the experience that you have with some of this literature searching, use of library resources, and so on that's going to come up in investigative skills. I've got some resource articles for you that we'll look at in a minute. You look at the rubric, that will help you with the writing process. And this is important here. So at this point, you're in graduate school and we expect graduate level work. There's a lot of variability in people's undergraduate experience with professional writing. And so my suggestion to you is that if writing is not your strong suit, and you're concerned about that, that you contact the UNR Writing and Speaking Center. They can do review of your drafts via email. They're super helpful. Our second years have been using them for the last few months to help develop their Capstone manuscript. So reach out to them, super helpful, lots of resources, whether it's grammar, punctuation, and so on. If you have questions, you can email them to me directly, of course. And then generally, as you guys have experienced, I'll usually email the whole class because I guarantee you somebody else has that same question. What I'd like to do in this course, more often than not, is put questions on the course discussion board so that everybody can see them. And so I'll activate that discussion board probably today. And I'd really like to use that in this course, particularly since it's primarily self-directed, so I can still feel like we're kind of connected and having a conversation, even if it's asynchronous. All right, it's hard to see in this photo, but Gary has made a friend who is across the way here looking out of the window. All right, so let's look into the Canvas module. So this is Capstone 1. Here is the link to the UNR Writing and Speaking Center. Super helpful. Again, they can work with you via email. They have lots of different modalities, even when we aren't in the middle of an epidemic. That's really helpful because of your schedules, right? Here are some Savit Library research and reference tools. You can click through that. EndNote, if you've never used this before, EndNote is a citation manager. You get a free subscription to it through the library. There are other citation managers out there, Mendeley, others. The one big piece of advice that I will give you related to citation managers is that you shouldn't trust them. They're great for setting things up, but I want you to comb through those citations before you submit your final product and check, recheck, and check again that AMA citation format, because the citation managers don't always get it right. Here's just informational stuff from AAPA about writing. The OWL, or the Online Writing Lab from Purdue, is amazing. I used this through PA school. I use this in my doctoral program. I still use this when writing up things for publication and so on. So it helps you with formatting, and it's relatively easy to search rather than looking things up in the giant AMA manual. Here's an AMA quick reference guide, just a little document to help you with your citations. All right, so jumping into the cat paper module, here's the video I'm making right now. Here's the PowerPoint from today, obviously, the PDF. Here's your template. Let's take a look at this. Okay. So when you submit this thing, first of all, don't use this as an actual template, like don't fill it in, make your own. But this is going to give you an idea of what sections belong in this paper. We don't want to keep any of this italicized stuff. So here's your critically appraised topic title, your name and the date. What is your clinical question? Make sure that it fits to the extent possible the PICO format. Here is the background area about your question, that who cares question, who's affected, why is it important to health and health maintenance and prevention, excuse me, public health and so on. And the articles that you use to support your background, there should be at least, 2 of them, maybe more than that, but these are going to be in addition. Actually, this should be a 3. I'm going to change that right now. That should be a 3. This should be in addition to the articles that you're actually going to appraise. So when you're using sources for your background, these don't necessarily need to be high-level evidence type of sources. So it may not even be research related. This would be informational, right? In the sense that this is the information that's informing the development of your question. And then you're going to look for peer-reviewed, high-quality research to support the analysis that you make related to your question. So your search strategy, you want to tell me which databases you searched. You can just document them in there. The search terms, often these search engines will save that for you, and you'll see that when the library works with you later this week. So all you have to do is cut and paste that in there. It keeps track of the search terms that you used. And then your inclusion, exclusion criteria, and so on. Once you have analyzed your high quality articles, you want to summarize the evidence. And you want to describe the key findings and limitations. And this doesn't have to be super long. Remember, the entirety of this cat paper, exclusive of this template that we'll talk about in a minute, should only be 2 to 3 pages. So you're only talking about doing 2 pages or so of key findings, limitations in your description of results. You want to put an evidence table in there, and this is actually something that's going to help you manage information as you do your research. I'll show you that in a second. And finally, we have a conclusion, basically. So you looked at all the info, you asked the question, you looked at all the information, and now you want to make a summary statement, right? A conclusion. Obviously, whenever we're talking about research, we want to talk about limitations, right? And sometimes suggestions for future research. That's often useful and included in people's write-ups. Your references, so these are going to be not just the 3 to 5 studies that support your question, but also the couple or however many you come up with of pieces of information, whether they're research-based or not, to support your background. So anything that you're using as a source, you're going to want to cite in your references in AMA format. So here's the evidence table I was talking about. You may have done something similar in PA role development. Basically, this is a way for you to manage your articles, right? So here's Article 1, Article 2, Article 3, Article 4. And this is going to help you kind of succinctly document the things that you took away from each of those articles. You only need to do this for the articles that support your PICO question, not the articles that are your background. However, those may be one and the same, right? So if you're using them for evidence, then you do want to document them in here. Hopefully that makes sense, right? You may use the same article both for your background and for evidence. So you just want to talk about the population. This may be different depending on what your question is. The population may actually be people, or again, it may be communities, organizations, and so on. What is the design of the study? What type of study is it? What is the intervention? What is the comparison, if such comparison exists? Their methodology, so just a brief description of the way the research was designed. How did they measure and describe their outcomes? And then a quick little summary. And we're just talking a few words here, right? This is basically for your own record keeping and for your reader to come through and look a little more closely at the things that you summarized back up in the body of your work. So that is your template. I want to save that. Okay. Let's look at your grading rubric. So here's your grading rubric. All right. How's your question structured? Is it relevant? Background? How did you search? It basically follows everything that's in the template, right? Pretty straightforward. Whoops, I lost again. Sorry. And then finally, here are two really great articles. If this video is kind of garbled and confusing, here's a really great article about how to write a critically appraised topic. This one is as well. So if you are still sort of confused, I suggest that you read both of those articles. And again, if you have questions, feel free to put them on the discussion board, right? Email them to me specifically. And ultimately, if everybody has lots of questions and there's still lots of confusion, I will probably put together a brief little live session on Zoom so that we can ask questions in that way. But I think, you know, this is a really, in my opinion, nice progression from what you've done previously in Journal Club that aligns well with what you're doing in investigative skills and is going to prepare you to do some high-level literature review when you're preparing for the Capstone 2 written assignment as you move forward. You guys have already heard my soapbox speech about the body of PA literature, and again, this is not only required by our accreditation standards, but it's something that's really important as a profession for us to up our game in generating high-quality literature. So thanks for listening. I apologize for any background noise, and I will see you later this week.